So this is chapter 20, and you'll find this in the Brady 13th edition. This is the lecture on allergic. So if you would like to, and you have the Emergency Care 13th edition, the Brady book, you will turn to page 559, labeled Allergic Reaction, and be sure and look at the objectives and the competency and the core concepts in that chapter, because those are required in testing for the EMT. Another page and reference you should be looking at is page 448 and 449 in that same book, which goes over epinephrine and the actions that the medication gives you. And a final reference would be page 170 and 171 on the immune system and how an allergic reaction happens. But to start out, we'll be starting on the chapter 20, page 559. The allergic reactions all has to do with our immune system, because it naturally responds to foreign substances in the body. An allergic reaction is an exaggerated response to a foreign substance in the body, and our immune system automatically detects and recognizes certain substances or invaders that come into our body, and that's the whole job of the immune system. It's responsible for fighting infection. It responds to specific body invaders, it identifies them, it marks them, and it destroys them. But it also remembers them, and so the next time that a person comes in contact with that specific type of invader into their body, the immune system will react more quickly because it remembers the response from the last time. This is a normal body response to infection. An allergic reaction then is a hypersensitive or an exaggerated response to that foreign substance, and it's produced by an allergen, which is a substance that the body has already recognized that has caused that exaggerated effect. So most people will not have, in fact just about everybody will not have, an allergic reaction on the first introduction to any foreign substance. The first exposure, what happens is the immune system forms antibodies. Antibodies identify and attempt to attack that particular foreign substance, and it's only after the antibodies combine with the allergen that they form that response. So the first time, it won't happen. The second time that exposure takes place, antibodies that the body has already created exist. And now the antibody combines with the allergen, and it leads to the release of what they call histamine and other chemicals into the bloodstream. And histamine will, in an exaggerated response, will produce edema, and in some cases it'll narrow the airways, causing changes in the ability of the body to breathe. And it'll also cause the blood vessels to become more permeable, so that fluid will actually pass across the membrane of those vessels and cause the fluid that's supposed to be in the vessels to be decreased. So the chemicals that are released after the antibody combines with allergen, histamine and other chemicals, can sometimes cause harmful effects, especially in an exaggerated response. Now, the effects of histamine and other chemicals, if you remember, there's three things that's going to happen. inflammation or swelling, bronchoconstriction, and vasodilation. And this is very important to remember when we're talking about an anaphylactic reaction, a severe one, because those are the three things we want to target to reduce the effects of those histamines and other chemicals. Anaphylaxis is a severe, life-threatening allergic reaction. This causes the rapid dilation of those blood vessels, hypotension, so their blood pressure is going to be low, their airway will swell, causing the airway to be obstruction, and we're talking about the bronchioles are constricting and also even sometimes in the upper airway. So they'll show signs and symptoms of respiratory failure. Some common allergens that the person that most people know about already, but good to review. Some common allergens are insects. Bees are very, very common for people to be allergic to. Foods, especially peanuts. Not everybody is allergic to, they may have a peanut allergy and still be able to eat other nuts. That's because sometimes peanuts are listed as legumes and not specifically a nut. So shellfish, seafood is another common food allergy. Plants, poison ivy is a form of causes immune response, and so it can be listed as an allergic type reaction. Medications, including penicillin or sulfa. Be careful when people tell you that they're allergic to things. Ask them what types of response they have, their body response they have, because they may have some mild itching, or maybe some people even have diarrhea or nausea and vomiting from specific medications. The difference between an allergic reaction and anaphylaxis is that it's going to affect the respiratory system and the cardiovascular system. So if they're having localized responses of minor itching, that would be an allergic reaction, not anaphylaxis. So once again, common allergens would be plants, insects, including bees, fish, shellfish, peanuts, certain medications. A lot of people are allergic to latex. This is a common concern in EMS because especially people that have lots of surgeries and come in contact with latex frequently can develop allergies to them. Another concern are people that are actually in EMS and wearing gloves. We wear gloves all the time, so that can develop a latex sensitivity. If you see when you take off your gloves that you've got a little bit of redness or pinkness every time, then you're probably starting to develop an allergy. So allergic reactions, when somebody's having one, there's no way to predict exact course of an allergic reaction. A severe reaction often can take place immediately, or it can be delayed even for 30 minutes or more. Mild allergic reactions can rapidly progress to anaphylaxis, so you want to be careful to monitor a person with an allergic reaction quite frequently and constantly reevaluate and make sure their blood pressure is staying up and that they're breathing okay. The easiest way to do this is to watch their work of breathing and see if it changes any. Count their respirations every 5 minutes if it's a critical patient, 15 minutes if it's a stable patient, and also check their radial pulses. Even if you've got a pulse ox on, check and see that you can feel a radial pulse, because if you have a radial pulse, you probably have an adequate blood pressure. Signs and symptoms to watch for. When it comes to the skin condition and this different organs we're going to talk about, what we will see in allergic reaction. And with the skin, you will see itching, hives, little dots, red dots throughout the skin. This can be localized, especially if it's like a sting, if it's around an insect sting, or it can be generalized over the wide areas of the body. Flushing, red skin. This is from the capillaries, the vessels becoming closer to the skin surface. Another word for hives, by the way, is urticaria. So they're red, itchy, possibly raised blotches on the skin. Urticaria is also hives. There might be swelling in the face, especially around the eyes and lips, neck, hands, feet, or tongue, which can be dangerous if it's a anaphylactic reaction. If you want to see some pictures of this in your 13th edition Brady EMS book, you can look on page 562 and you will see some pictures of allergic reactions and some of the signs and symptoms. Figure 20-3, figure A, shows a local angioedema. This is and it's really kind of crazy to see something like this when somebody has an allergic reaction, but you can see where the swelling of the lower lip might be completely exaggerated, and it actually gets pretty huge. There also might be some warm tingling feeling in the face, mouth, chest, feet, and hands. And here's an allergic reaction that includes facial swelling. And you can see this puffiness around his lips and also his eyes, a little bit puffy. And here's the hives. So the respiratory system, some things you want to look for: tightness in the throat or chest, or if they have a cough, develop just a little bit of a cough, rapid labored or noisy breathing, and if you might even see as they work to breathe, see their intercostal contractions, hoarseness or muffled voice, loss of voice, or even severe enough that it might be stridor, the high-pitched kind of ee, ee, as they try to breathe in. And wheezing. Wheezing is in the lower airways, and it's the sign of the constriction of the bronchioles. So listen in several different areas as you listen to the lungs. Cardiac signs: increased heart rate and decreased blood pressure. The blood pressure will be dropping in an anaphylactic reaction. Not quite so much in an allergic reaction, but more so the decreased blood pressure in an allergic reaction. And some other generalized findings would be itchy, watery eyes, headache, runny nose. If it's developing into anaphylaxis, they might have that sense of impending doom. And then as you see it progress and you see signs and symptoms of shock, it's now progressing into the anaphylactic phase and not so much the allergic phase. If they start having altered mental status, flushed, dry or pale skin, cool, clammy skin, nausea or vomiting, and their vital signs are changing, they're having increased pulse and respiration and decreased blood pressure, those are your signs and symptoms of shock. Two things you're looking for to differentiate anaphylaxis from an allergic reaction. It is becoming anaphylaxis if they have difficulty breathing and a decreased blood pressure. So when it's affecting the respiratory system and the cardiovascular system, you have anaphylaxis. So on a mild allergic reaction, we might not have to do too much for. Just monitor, give them a little bit of extra oxygen. To be considered a severe allergic reaction or anaphylaxis, the patient must have either respiratory distress or signs and symptoms of shock. Identify your patient and treat any life-threatening problems. This is the same assessment algorithm that we've learned all through the years of being an EMT, and you'll continue to learn a nice procedure way. So we start out scene safety and then on to our primary assessment. Look at the airway, the breathing, the circulation, and the mental status. We need to find and treat any life-threatening injuries in the primary assessment. Don't want to miss anything. Our secondary assessment, we would start looking at the things of what type of history they have. Do they have a history of allergies? And here's some important questions to ask now that you know that they have an allergic reaction. What were they exposed to? And how were they exposed? What route? So you can either be exposed by an injection, or by inhaling something, or by touching something. And which route is the most quick response? If you're injected with something, you'll probably get a quicker reaction than if you were touching it and getting it on your skin, just kind of as an indication. So exposure, how were they exposed, what were they exposed to, and then now looking for the signs and symptoms and the progression of those signs and symptoms. What happened first, and then what happened after that, and how rapidly did it happen? And the last thing you want to know is, what have they already done? A lot of times people try to take care of themselves before they call an ambulance or even go to the doctor. So you want to know, what have they done to try to help themselves? Have they taken any medications? Have they put in any salve on it or anything like that? So this is important to know so that you can adjust your treatment. They may actually have already given themselves an epinephrine injection if they have that in their house. And also, as a part of your secondary assessment is to assess baseline vitals. Once again, you will automatically know the blood pressure if you've checked a radial pulse in your primary assessment. Anybody that doesn't have a radial pulse probably is in shock already, and that needs to be addressed from the beginning. But once you're into your secondary assessment, now it's time to get yourself a set of baseline vital signs. And then remember to ask about the past medical history. Do your sample, signs and symptoms, allergies, medications, pertinent past history, last oral intake, and events leading up to. Manage your patient's airway and breathing. Apply high concentration oxygen if the patient is in distress or appears to be having an anaphylactic reaction. If it's a mild allergic reaction, most of the time you do not need oxygen for that. And if it's severe enough, they may even quit breathing. So make sure you're assessing the respiration and adequately providing artificial ventilations if it's not adequate. If they just need a little bit of oxygen, give them oxygen. And if it's mild, probably no oxygen is required. For the severe anaphylactic reaction, it's time to consider giving the patient an epinephrine auto-injector. So if they're not wheezing or showing signs of respiratory distress or shock, you can just continue your assessment and consult medical direction. But if they are showing signs of symptoms of respiratory distress, or if they are showing signs of shock, including low blood pressure, if you cannot feel radial pulse, they're probably in shock. Okay, and now it's time to give the epinephrine auto-injector. When you use an auto-injector, you're gonna have good history. The patient has come in contact with a substance that caused an allergic reaction in the past, and now they're having respiratory distress and signs and symptoms of shock, and they need something to help their body to compensate for that immune response. You use the epinephrine auto-injector. Once you use it, you record the administration of it, you transport the patient, and you reassess it every 2 minutes. You may need to give a second dose. After you administer the epinephrine auto-injector, get your vital signs, get en route to the hospital, and you might need to take an extra EpiPen along with you. If you don't have one in the rig, which in Illinois we do have EpiPens in our rigs. In our system, we are also allowed, because it's cheaper and the cost of the EpiPen has become so extraordinary, we have the option now to do epinephrine injector. It's an intramuscular injection that you can actually draw up the epinephrine and give a shot to the patient. And those are things that we will talk about just shortly after we've completed the reasons for giving epinephrine. So the question is, should you administer an auto-injector for a simple allergic reaction? The answer to that is no. A simple allergic reaction generally does not require the use of epinephrine. What assessment findings would indicate the need for epinephrine? Two things that you're looking for an anaphylactic reaction that would require epinephrine. And you must have either respiratory distress or signs and symptoms of shock, and that would indicate the need for epinephrine. So let's watch the video and we'll be able to see what actually is happening in an anaphylaxis reaction.
The immune system reacts to any foreign substance. Allergic reaction or anaphylactic shock occurs when this response is exaggerated. Some symptoms of anaphylactic shock can include hives, flushing, facial swelling, itchy watery eyes, runny nose, and rapid breathing. Exposure to an allergen causes dilation of blood vessels, increases heart rate, and decreases blood pressure. Swelling of tissues lining the respiratory system can obstruct the airway, leading to respiratory failure. The presence of either respiratory distress or symptoms of shock indicates anaphylaxis.
Okay, now sometimes too you may have people that have what's called a rhinitis, and it's a form of an allergic reaction with itchy, runny nose, watery eyes.
Allergic rhinitis occurs when people who are allergic to airborne particles of dust, dander, or the pollens of certain seasonal plants have been exposed to these substances. Symptoms include coughing, headache, sneezing, and itching nose, mouth, and eyes. When an allergen is inhaled by a person with a sensitized immune system, it triggers antibody production. These antibodies bind to cells that contain histamine. When the antibodies are stimulated by pollen and dust, histamines are released. This causes itching, swelling, and mucus production. Symptoms vary in severity from person to person. Very sensitive individuals can experience hives or other rashes. Heredity and environmental exposures may contribute to a predisposition to allergies. The history of the person's symptoms is important in diagnosing allergic rhinitis, including whether the symptoms vary according to time of day or the season, exposure to pets or other allergens, and diet changes. Allergy testing may reveal the specific allergens the person is reacting to. Skin testing, the most common method, includes intradermal scratch patch tests. The goal of treatment is to reduce allergy symptoms caused by the inflammation of affected tissues. The best treatment is to avoid what causes allergic symptoms in the first place, or to take steps to reduce exposure to allergens. Medications include over-the-counter and prescription antihistamines, nasal corticosteroid sprays, and decongestants. Allergy shots, also known as immunotherapy, are occasionally recommended if the allergen cannot be avoided and if symptoms are hard to control.
Okay, so to administer the epinephrine auto-injector, quick review, this is still in the Galesburg protocol for the pediatric patient. We can only give the manual shots to adult patients. So for anyone in the Galesburg system, to self-administer epinephrine or to administer epinephrine, then it would be the same. This would apply to the pediatric patient. So epinephrine, it's commonly prescribed to patients with a history of allergies, and auto-injectors are the most common for people to carry or have at home. Epinephrine is actually a hormone that's produced by our body. It's adrenaline. So that explains some of the side effects of what adrenaline does to our body you can expect to see from epinephrine. Adrenaline speeds up our heart. Adrenaline constricts our vessels so that we can perform better and perform faster. When we stimulate our body, it's adrenaline that does it. It also dilates bronchioles. So it's actually working to fix a lot of the things that are going on in an anaphylactic reaction. Because if you review and remember what those signs and symptoms were that we talked about, those were some of the things that histamine was doing to our body, causing the bronchioles to constrict and causing the blood vessels to dilate. So you can see epinephrine will work to do the opposite of what histamine is doing to our body. Epinephrine is a very potent drug. It's given to people in cardiac arrest. So too much epinephrine can actually do a lot of harm to someone that does not need it. Epinephrine is a prescription drug. It's got to be authorized by medical direction. If it's carried on the ambulance, it's carried because of medical authorization. We have medical direction allows us to carry it. And you can administer or help the patient administer a dose of epinephrine to themselves if they have their own auto-injector and it has been prescribed to that patient by a physician. You cannot help somebody who doesn't have a prescription for it unless you're working under your protocol on the ambulance. Side effects to epinephrine then are going to be the increased heart rate and increased cardiac workload. When you administer the epinephrine auto-injector, the auto-injector is a spring-loaded needle and a syringe with a single dose of epinephrine in it. When you administer it, the medication automatically releases and injects into the body. You can do this through clothing. In fact, that is the way the manufacturer recommends it. Here's a picture of the epinephrine auto-injector. When you administer that, you want to obtain the patient's prescribed auto-injector or make sure that it is in your protocol to utilize. Make sure the prescription is written for the patient, that it's not discolored. Another thing that you want to look for is make sure that the medication is not cloudy and that it's not expired. Make sure you have authorization from medical direction. Remove the safety cap. Press the tip of the auto-injector firmly against the patient's thighs, outside of the thigh, midway between the knee and the waist. and hold the injector in place until the medication is injected. Then you want to record the administration and time of the epinephrine. Carefully dispose of it in a biohazard container, in a sharps container, and make sure that if you have one of those twin jects, they have actually 2 doses in there. So save if it's a 2-dose injector. Reassessment may show the patient's condition deteriorating shortly. If they should improve dramatically initially, but if you reassess and you see that they're starting to deteriorate again, you may have to give an additional dose of epinephrine. To do that, you need to get online medical direction. If there's no auto injectors available, be sure and request ALS Intercept and treat them for shock. 2 sizes of auto injectors. Adult, which is yellow, it has 0.3 milligrams of epinephrine in it. The children's dose, and this is for kids that are less than 66 pounds, it's 0.15 milligrams, so half of the adult dose. It's in a green epinephrine EpiPen injector. So on the Nauvoo ambulance, there will be green EpiPen Juniors for any child less than 66 pounds. It's actually very rare for a infant to have a sensitivity because they have an underdeveloped immune system, so it's very rare for an infant to have an allergic reaction. And that's why you don't see infant type dosing. So, just in review, allergic reactions are common. Anaphylaxis is a true life-threatening allergic reaction. It's rare, but when it happens, you want to be able to do something about it, and it is life-threatening. The most common symptoms in these cases is itching. Patients with anaphylaxis will also display life-threatening difficulty breathing and/or signs and symptoms of shock. Patients with anaphylaxis will be extremely anxious, their bodies are in trouble, and the body is letting them know it. The signs and symptoms of anaphylaxis result from physiological changes. The blood vessels are dilating, the bronchioles are constricting, the capillaries are leaking, and thick mucus is being performed from the histamine and the other chemicals that are released. By quickly recognizing the condition, consulting medical direction, and administering the appropriate treatment, you can literally make the difference between life and death in these patients. So, to review a little bit about the immune system and what's happening there, you can actually turn to page 170 and 171 in your Emergency Care 13th edition book, and it will give you a good review of what's going on in the immune system and the histamine response that's taking place. You need to know also that epinephrine is the treatment of choice for anaphylaxis, and a good place to review that is page 449 in the Emergency Care 13th edition, and it also will list the actions of epinephrine. The reason that epinephrine is causing that vasoconstriction is because it's working on alpha receptors in the sympathetic nervous system. The bronchodilation to open up the constricted bronchioles is because the epinephrine works on the beta receptors in the sympathetic nervous system. So epinephrine works on 2 types of receptors in the body, causing the bronchodilation and the vasoconstriction. Epinephrine also has potentially dangerous side effects, should be used only in the event of anaphylaxis, And if you have a patient that has cardiac problems and cardiac history, then you might want to be a little bit cautious in administering it, because that epinephrine is going to cause the heart to work harder. So, what are the indications for administration of an EpiPen autoinjector? You've got to see either signs and symptoms of respiratory compromise or signs and symptoms of shock in a true anaphylactic emergency. Some of the more common causes of allergic reaction would be peanuts, bees, shellfish, some medications. So, list the signs and symptoms of an anaphylactic reaction associated with each of the following. In the skin, you might have hives, itchiness. You might have flushing, red skin, swelling in the face, and maybe a warm tingling feeling in the face, mouth, chest, feet, and hands. Respiratory system. Patient may report a feeling of tightness in the throat or chest. And I'm getting all of these straight from page 563 in your Emergency Care 13th edition. Rapid breathing, labored noisy breathing, hoarseness, muffled voice or loss of voice entirely, stridor or wheezing. Cardiovascular system, an increased heart rate and a decreased blood pressure. So a 24-year-old male ate a meal that he believes contained shellfish. He is allergic to shrimp. He is sweating and nervous. He appears to be breathing adequate. You do not know any wheezing or stridor. Is he having an anaphylactic reaction? No, in this case he is not having an allergic reaction. His face is slightly red, his pulse is 88, strong and regular, respirations are 24, blood pressure is 108/74, and skin is warm and moist. Would you administer epinephrine? No, in this case, he is not having an anaphylactic reaction.